Hello, everyone. I'm delighted to be here again with Dr. Mishkat Shehata. I think this is
Hi,
our fourth,
everyone.
is it?
Yeah,
Yeah,
I
this is
think so.
my turn to interview you this time. So,
Yeah.
very important subject. One around breast cancer and breast cancer awareness. And something that the fitness industry and people's fitness levels can also really impact strongly. So, why don't you start by just giving us some cancer facts and backgrounds, and then we'll go and have a discussion around how the fitness industry can help.
Yeah, let's do that. So, cancer is actually the second cause of death globally. It amounts to estimated about 9.6 million deaths in 2018, according to the WHO. And that means so 1 in 6 deaths are attributable to cancer in general. When we talk about breast cancer specifically, about 2 million women each year have cancer. And it's actually the greatest number of cancer-related deaths among women are due to breast cancer. It's estimated that nearly 600,000 women died from breast cancer in 2018, and that's the latest data we have. And amongst all cancer deaths amongst women, it amounted to about 15% of those. So it's quite a big number.
Wow.
Yeah, and actually, the link with cancers in general and breast cancer is that if you don't move enough, you're more likely to have adverse health outcomes, as well as increase your risk of cancer and chronic diseases. So, worldwide, the latest findings of the WHO show that there's an estimated 1.4 billion people not moving enough to stay healthy, which is about a quarter of the globe's population. And if we asked these people to move more, then we would actually stop 1.3 million deaths from happening each year. That's huge.
That's a very tangible link.
Yeah.
And,
And
and is there
in
different movement and exercise that can improve it? Is there a specific range of exercise or amount of exercise that helps?
There is absolutely. So there's three things that we focus on when we talk about exercising and moving and physical activity. So physical activity is any movement that we do that expends energy beyond our baseline. Whereas with exercise, it's specific, it's recurring, it's with the intention to improve our one or more health components. And what the first thing we like talking about as lifestyle doctors is that we always ask people to sit less. So however many steps in the day or hours or minutes that you can get moving. That's the first thing that you need to do. The second thing is undertaking aerobic exercise. So things like jogging, swimming, tennis, those are different examples. And those can be at different intensities, Eddie. So there's something called moderate intensity exercise, and there's vigorous intensity exercise. Apologies if you hear dogs barking in the background. With moderate active, and the way you differentiate between moderate and vigorous activity is something that I like to call I like to tell my patients about, which is the talk test. And so if you're able to sing, if you're not able to sing, but you're able to talk when you're exercising, that means it's moderate intensity. And if you're not able to sing or talk, then it's vigorous intensity. And for moderate intensity exercise, sorry?
I should ask everybody to sing in the gym while they're exercising then.
You should. If they're able to sing, they're not moving enough. They're not going enough. Exactly. If they're able to reply back, then they're not undertaking vigorous activity. So they can take either or, vigorous intensity or moderate. It can be a combination of the two. If you want to aim for vigorous intensity, you should get about 75 minutes per week. That's the recommendation. So 15 minutes every day, 5 times a week, job done. If you're aiming for moderate intensity, so like a light jog or brisk walk even, that needs to be 30 minutes per day, 5 times a week, or 150 minutes over the course of the week, however you choose to split it. And then finally, the third type of thing that we recommend in terms of exercise as well is strength training with flexibility and balance. And strength training needs to be two sessions per week with flexibility, minimum once per week. And strength training doesn't have to be going to the gym and, pumping weights. It can be carrying a heavy load of shopping, or undertaking yoga, for example, or Tai Chi. So all of these things are building your strength in different ways. And strength training is especially important for women and breast cancer specifically because of two reasons. The first reason is that women are prone to osteoporosis, which is the bone thinning, and strength training or resistance training directly improves bone density. And the second thing with breast cancer is that women who have breast cancer and end up, becoming menopausal due to certain medications that they have, and having less estrogen in their bodies because some type of breast cancers feed on estrogen, then they are, running the risk of again becoming osteoporotic. So strength training comes in there really as an important factor in terms of their physical health as well.
Okay, so it's not just statistical evidence linking cancer rates with exercise. There's also now very non-medical evidence as what the cause and the prevention can be in there as well.
Definitely. There's lots of great studies, actually. I can tell you about a couple of them if you would like.
Please, yeah.
Yeah. So there's two studies. One of them was in 2007, published then, and it's called the Women's Healthy Eating and Living Study. And that looked at 3,000 women who had already had breast cancer. And they were the researchers were trying to find out what could be done to reduce their risk of cancer recurring. Mm-hmm. So they split them into two groups. The first group had a healthy diet with 5 pieces of fruits and vegetables per day. And the other group had 8 pieces of fruits and vegetables per day. And they were given more exercise as well. And what they found was the first group that were eating 5 fruits and veg had a 10% risk of developing cancer, again, after they'd already had it, whereas the ones that were eating 8 or more and being more active had a less than 5% chance of having cancer again. Mm-hmm. And actually, within those, there were like subgroups of the women who ate 8 pieces of fruits and vegetables a day. And they found that women who they were eating fruits and vegetables but not active, they were eating the 8 but not moving, they then had a 10% risk of death, similar to those who were eating 5 pieces of fruits and vegetables. So as you can see, the combination of moving and eating at least 8 pieces of fruits and vegetables a day and undertaking daily physical activity is the best chance of you preventing your risk of having breast cancer if you've had it already, and also obviously translates to reducing your risk overall. There is another study, it's called what we call a meta-analysis. So it's looking at all the studies put together and trying to see whether there's something we can draw out from them. And that was conducted just 3 years ago by Hamer and Warner. And it was looking again at lifestyle modifications for patients with breast cancer to improve their prognosis, to see what improved their prognosis and optimize their health overall. And they found 22 studies that found that physical activity actually reduced the risk of deaths caused by breast cancer by around 40%. Wow. And their recommendation of physical activity was at least 150 minutes per week of aerobic activity, as we've just talked about.
Mm-hmm. And as well as activity, we hear a lot about the BMI and body mass index. That also has an impact on cancer rates?
Yes, absolutely. So the link between obesity and being overweight is that you end up having 2 things, specifically to breast cancer. The first thing is that you're in a pro-inflammatory state, and a pro-inflammatory state increases your chance of developing chronic diseases as well as cancer. And the other thing is that when you have more fat around your body, you have more estrogen. And the estrogen actually increases your risk of not only breast cancer, but also womb cancer as well. So there's a huge link there with having, a healthy BMI. So for women, for anybody, we would like your BMI to be less than 25. For specific ethnicities that have an increasing risk of type 2 diabetes, like Asian or Middle Eastern backgrounds, then the BMI cutoff for being overweight is not 25, it's actually 23. Which a lot of people don't know, actually. So it's really important for us to emphasize this bit. that, so for me, my healthy BMI would be 23 and below because I'm Middle Eastern, but for a Caucasian female, less than 25 is fine. So BMI of 24 is absolutely fine.
Okay.
Yeah.
Oh, fascinating. Yeah. So just a couple of final questions. If you are unfortunate, and I hope this never happens to anyone listening, but if you are unfortunate to be diagnosed with cancer, exercise can still help, both during and after treatment, I believe. Perhaps you just tell us a little bit about how exercise can help, even if you are unfortunately diagnosed with cancer.
Correct, absolutely. So after you become, after you have a cancer diagnosis, it doesn't mean, people, I think they sort of panic and say, right, I've had cancer, I don't want to do anything that will risk me developing it again. But actually, the best thing you can do is to start exercising, because we know that it reduces your risk. But also, people who have had a breast cancer diagnosis, it's life-changing. With it come, a potential of impacting on your mental health, on your and how you interact with your family. You might, feel a bit more withdrawn, feel worried. And all of these things can improve with exercise. And also, undertaking exercise in a group setting is really important as well for people who are breast cancer survivors or survivors, because you have that moral support, which you really, really need at that point in time, because you're going through such a tough time. And it's it impacts on not only you, but your family. So it would be a great opportunity for people to think about taking their families along the journey of moving more.
Maybe a little bit of a freeze on the connection now, on such a serious point as well. Maybe you can get back to me on time here. You back in? You froze a bit there.
Can you hear me?
Yes, I can hear you. You froze just at the end of a very, very important point there around maintaining your activity and your exercise and your positivity, even during and after diagnosis.
Yes, absolutely. Because as we've said, it's an emotionally charged time. It's not, it's life-changing for not only the woman, but also her family. So trying to find a positive activity that they can do together to improve their health overall, but also reduce her risk and help with her mood, help with all the symptoms that women may develop after having an operation or after having chemotherapy and radiotherapy. Some of the medications as well, like tamoxifen, for example, that we use to treat breast cancer, they have a lot of side effects that can be reduced by exercising more. So, for example, fatigue is very common in patients who are having cancer treatments, or even who suffer with cancer, who have a cancer diagnosis. And it may seem counterintuitive to think, I'm absolutely exhausted, I'm not going to go out for a walk. But actually, moving will help you boost your energy and improve that patient's ability to tolerate the treatments as they go through them, and even just have less side effects of having the cancer on its own. So my advice would be to start slowly. If you haven't been active before you became, if a patient had, if someone's diagnosed with cancer and they haven't been exercising, to start slow and in a safe environment that's quite supportive, making sure they eat well. We've talked about the importance of fruits and vegetables in this case, and staying hydrated, definitely, because you want to put in the fuel into your body that makes it work well. It's like a car that's running on diesel when it's meant to be given petrol. So I think that's the way we need to think about these things, fueling your body correctly, and also listening to your body. So if they're starting to feel like they're doing too much, slow it down. It's not a race. Take it at your own pace and do something that you enjoy, most importantly, so that you can keep doing it.
And I like to think that the gyms and the fitness community can actually help you find the right level of exercise and the right type of exercise for you. You've mentioned quite a few in here: swimming, running, but the wonderful thing about exercise, be it mountain climbing, tennis, walking, hiking, swimming, going to the gym, playing table tennis, whatever it might be, there's thousands and thousands of options for exercise.
Absolutely. Absolutely. Yeah.
Yeah, we got the Dubai 30-30, 30 minutes of exercise, 30 days on the row, starting at the end of October. So we're going to be heavily involved in that too. And I guess it's a good point to close to say, you know, there's a lot that we can do in the fitness industry to help with this really important subject and just keeping people moving as well.
Completely.
And it doesn't always, as you say, have to be in the gym. You know, we can put out material like this, online material and exercise and things. Just this evening we did exercise in the park. We did a boot camp in a park.
Nice.
Just so that everybody passing by can see people exercising, see people having fun, you know, and just join in. So
yeah,
I do hope we as an industry can contribute to this, you know, very serious subject we got here. So thank you very much again for your time.
No, thank you for having me. It's been a great chat.
Very interesting, but this one particularly important and fascinating subject. So thank you very much.
Definitely. Thank you for having me.